We promised that health was so critically important. And I told you how they let it run down. Basic prescriptions could not be filled in our hospital. And we are trying to improve upon that. If you needed an MRI, you had to go to Antigua, Puerto Rico, USA. We say enough of that. And we entered into an agreement with a private partner who had long been in the medical field. And today in St. Kitts, every Kittitian and Nevisian who wants an MRI service done can have that done. And that is now being done in St. Kitts at the St. Kitts biomedical facilities. Over 200 persons since the program started have had their MRI done at home. Not 1 cent they had to beg, borrow, or ask for to go to Trinidad, to go to Antigua, to come to the States to get the MRI done. That is progress in the land of your birth. We are concerned that the cancer problem is becoming rampant in the Caribbean region, in St. Kitts, in the B.V.I, in Antigua, in Trinidad, everywhere. You hear somebody pass. Shortly you will hear it's cancer, breast cancer, this cancer. What have we done? In the short term that we have there, we have built a cancer center at the Joseph N. France Hospital, soon to be open, to deal with the pain and agony and trauma of having within our midst so many persons suffering from a silent killer called cancer. This is a government at work for you. Some of you come home and you sometimes ask, why you all got them crazy people walking around town so? Pinda, and when they're in Pinda is somebody else. In the short period that we have been there, we have invested $1 million to build a mental daycare center so that we can take up those people who will be going around town, not knowing what they're doing. Maybe sometime they well know, but they can't control themselves. And we put them in a safe spot where they could be cared for and looked after in the daytime. And you know what a tremendous relief this will bring to family members, because there are a lot of people in the country who have relatives and friends who have had mental issues. We say they have mental breakdown. Sometimes we say they're crazy, but they ain't really crazy. And we stigmatize them. And the families themselves sometimes become too proud to want to associate with them. And so they leave them on their own. We are saying that we have to be a more caring and a more compassionate society, and the government is prepared to do that. But we understand how trying a task it could be for a family member with somebody who we call crazy, having to take care every day. Some families trying their best, but the stress is too much for them. And we are happy that we are able to do something about that.